Here we are again around the kitchen table, and today many of my patients have asked about asthma and some of the questions regarding asthma and allergies and whether they have asthma or allergies or both. So what I wanted to talk about today is how do we know the difference between asthma and allergies? Because sometimes when we focus on our asthma, we want to know, does my child, when they come in, does my child have asthma? People are saying my child has asthma. So asthma is a clinical diagnosis. There's not really a specific test or a specific thing that you can do to diagnose it. It means that on several occasions, probably 3 occasions, you've had wheezing, cough, congestion, that was resolved by using a beta agonist or albuterol. And many times we think of asthma, you think of noisy breathing, but it's really not. The first sign of asthma is cough. So if your child is having a lot of quote asthma attacks, but doesn't have cough as the main symptom, it's probably not asthma. We need to rethink that. Probably upper airway congestion due to allergies or colds or some other thing going on. So again, let's talk about the ABCs of asthma. First, asthma is an inflammatory disorder. That means that inflammation causes the airway to spasm and to get wheezing. Wheezing is just air moving through a small airway. So when that airway spasms, you start to hear that wheeze, or if it shuts down completely, you might not hear anything, but wheezing is air moving through a small airway. So when we talk about asthma, we talk about having a 3-step plan, an avoidance plan, a maintenance plan, and a rescue plan. So avoidance plan, we're trying to figure out what are the triggers. What's triggering that cough? What's triggering that wheeze? What's triggering that noisy breathing? First and foremost, when we think about that, we think about colds, or we think about allergies, or we think about irritants. All these things can stimulate and cause inflammation in the airway, and ultimately for the airway to spasm. So the first step, again, is your avoidance plan, trying to avoid whatever those triggers may be. Now, that may not be easy because you may not be able to identify those, or those triggers may be so predominant in the area that you're in, whether it be your house or school or whatever. Those irritants may be constantly be there. So that brings us to your next step, which is your maintenance plan. So you got an avoidance plan and a maintenance plan. A maintenance plan would be that daily medication that you would be taking to try to prevent an asthma exacerbation. So what would that be? What does that look like? That looks like an inhaled corticosteroid. So that's like Flovent, or even some combination of a beta agonist and a steroid, or a beta agonist or a long beta agonist with a steroid. So these type of medications would be your maintenance plan. When would I use those? If I had a child who was using more and more albuterol, at least 2 or 3 times a week, or maybe just twice a week, and it's becoming more and more common that they're using their inhalers. So the inhalers are your rescue plan. So if you're always in rescue mode, then you got to consider using one of these maintenance medications. So again, an avoidance plan, a maintenance plan, a rescue plan. Having an asthma action plan helps to kind of help you work your way through those 2 plans. So if, for example, you're on a maintenance plan, that would be your daily medicine every single day. Your Flovent, you use it every day, whether you feel good or whether you feel great. You would, if you feel bad, same thing. You would use that thing every day. And if you still have problems using that every day, you're coughing, wheezing, difficulty breathing, then you would go to albuterol. Albuterol, 2 inhalations every 4 to 6 hours generally would be what you would use during the periods where you're having difficulty breathing or cough. Again, so avoidance plan, avoid that trigger. Your maintenance plan is going to be that daily medicine you're taking every day. And then your rescue plan would be your inhaler. So again, if you have any further questions, if you want to leave comments, you can. Again, that's around the kitchen table. Just talking about asthma, a little bit something people wanted to ask, people wanted to know.